everyone. Dr. Jeff here with you again this week with Megan. It's February. We're still in Healthy Heart Month. Last week we talked a little about stroke and heart attack. I thought this week we talked a little bit about blood pressure. So what is blood pressure? Well, it's the pressure in your circulatory system. So if you think your circulatory system in your body is a one big hose going around through the body with a pump in the middle of it, and that's your heart. So what happens when your heart contracts, it squishes and it pushes more fluid into the system. And this is kind of similar to putting air in a balloon. If you're blowing air up in the balloon goes up and there's more pressure applied. And this is called your systolic pressure. And the ideal is to be around 120. When the heart's at rest, in between contractions, we call that the diastolic pressure. That's like if we take the balloon now, we let a little bit of air out of the balloon and pinch it back off again.
A number that we want to shoot for, as Dr. Jeff mentioned briefly, is 120 over 80. This is the number that we want to try to shoot for our blood pressure to be at. It can go a bit lower, but as those numbers increase, and if they increase, then it leads to greater health concerns. So if that top number, the systolic, the 120, starts to raise between 120 to 130, but the bottom number stays the same, then this is called elevated. And if that top number stays between that range and the bottom number 80 rises to 90, or in between that range, then that is stage 1. And if either of those numbers go from higher than 140 on the top or higher than 90 on the bottom, then this is stage 2.
Yeah, so it's very important that you monitor your blood pressure because, again, the higher the blood pressure goes, the more issues you're going to have. So some signs and symptoms, you may be having some blood pressure issues. If the blood pressure is low, one of the symptoms may be that you get dizzy or you faint, or when you get up from a chair or get up in bed in the morning, you're just a little wobbly in your feet. And having low blood pressure is certainly a little better than having high blood pressure. But with high blood pressure, what you might notice is that you may be getting a headache, unexplainable, kind of this pressure type of headache. You may get abnormal number of nosebleeds on the time of year it is. Again, that's the pressure that's being applied and the vessels in your nose are breaking. Also, some things like shortness of breath, very similar to a heart attack. Of course, the ultimate sign your blood pressure is too high is a stroke. It's the number one cause of stroke. It also plays as an important part and role with heart attacks.
Yeah, and there's a couple things that we can do lifestyle-wise that we can do to try to maintain our blood pressure. For the negative things that we can try to avoid, the first one and one of the biggest ones is salt. We want to try to keep our salt under 2,000 milligrams a day. And why this is because as we take in salt and more salt, the body needs to take in water as well to keep the homeostasis and to keep the body at bay. And as we bring in more fluid, then as Dr. Jeff talked about before, that balloon expands. Some other things that we want to try to avoid is caffeine, also trying to avoid smoking and really decreasing those levels. We also want to try to maintain a proper body weight. Now, in terms of the good things, we want to make sure that we're exercising, we're getting a good sleep, and we're also managing our stress. And in terms of things that we can take, potassium is really good, coenzyme Q10, also fish oils. If you're looking at herbs, then garlic is really good. You can also look into a diet called the DASH diet. And if you like alcohol, then this is one of the times that it actually help. It's been shown that for females, having 1 to 2 drinks a day or up to a max of 10 a week, and for men, 1 to 3 drinks a day or up to a max of 15 per week actually helps decrease blood pressure.
Yeah, so there's different things we can do to try and maintain that proper blood pressure. One thing you may notice, especially with pregnancy, is that pregnancy, you have a tendency for your blood pressure to start to go up, so it's very important you monitor your blood pressure during your pregnancy. Also, women over the age of 50 seem to be abnormally higher ratio than men of getting high blood pressure. And blood pressure is very important to monitor because it affects a lot of systems. You mentioned stroke and things, but also that increased pressure in your system really affects your organs like your liver and your kidney and your eyes. You also may notice that you start to get more bruising in your arms and your legs because the blood vessels will start to break and cause more bruising. It doesn't really hurt, but again, that's another sign, a symptom that your system is not working very well. So in our office here, when you come in for your first visit, we will take your blood pressure and keep an eye on it. And generally, if we notice it's been a little high, we'll monitor it. When you're going out and taking your blood pressure, it's very important that if you're walking around the store and you go to sit down and take your blood pressure, make sure you sit there for a minute or two, because what happens is that systolic number can go from 120 to 140 very easily. Just getting up out of your chair and going to the bathroom, that number can go up. So when you're taking your blood pressure at the store or at the pharmacy, make sure you sit down, give yourself a minute or two, take some deep breaths, try and relax, and make sure when you're taking the blood pressure, the cuff is kind of at your heart level, to get rid of any possible elevated signs and get false readings. Same thing at home. If you're taking your blood pressure at home, make sure that you sit down for a minute or two, collect your thoughts, take some breaths, and then take your blood pressure. And again, make sure the cup is kind of at your heart level, because we don't want to get any false readings. We want to make sure you're getting proper readings. So again, blood pressure is very important for your health. It's very important that you stay on top of it and keep it monitored. If you have any questions about anything we talked about here today with Megan and myself, you can always email us at jgoldsworthy@goalswills.com, or you can talk to us via Facebook. If you have any questions at all you would like us to look into for you, you can always send them to us, and we can certainly investigate it for you. As always, I'm Dr. Jeff. I'm here with Megan, and we've got your back.